Cats can be subtle creatures, and unfortunately their cries for help aren't always obvious. As a responsible pet parent, it's important to recognize when your cat may be trying to tell you they need help. Here are 10 signs that your cat might be in distress and what you can do to help them feel better. 1. Sudden changes in appetite. If your cat suddenly stops eating or, on the flip side, starts eating more than usual, it could be a sign that something is off. A loss of appetite is often one of the first indicators of illness, signaling anything from dental problems to gastrointestinal issues or even chronic conditions like kidney disease. On the other hand, an increased appetite might not be as innocent as it seems. It could mean your cat is stressed, bored, or even dealing with conditions such as hyperthyroidism. Any sudden change in eating habits is your cat's way of telling you that they need help, and it shouldn't be ignored. If your cat refuses to eat for more than 24 hours, it's time to call the vet. Skipping meals can lead to serious health complications, especially in cats, who are prone to a dangerous condition called hepatic lipidosis, or fatty liver disease. This condition occurs when a cat's body begins breaking down fat for energy due to a lack of food, overwhelming the liver and putting your pet at serious risk. Early intervention is key, and catching the issue before it escalates can make all the difference. 2. Excessive meowing or yowling. If your usually quiet cat is suddenly vocalizing more than usual, it could be their way of signaling that something isn't right. Cats often use excessive meowing to express pain, stress, or anxiety. It's important to pay attention to any changes in the tone or pattern of their meows. If the sounds seem urgent, distressed, or occur more frequently during odd hours like the middle of the night, it's worth investigating further. They might be feeling discomfort, seeking attention, or even dealing with a health issue that requires immediate care. Sometimes, excessive meowing can indicate loneliness or a need for companionship. Cats can get stressed by changes in their environment, such as a new pet or person in the household, or they may simply be bored and craving interaction. In other cases, a sudden increase in vocalization can point to an underlying medical condition, such as hyperthyroidism or cognitive dysfunction in older cats. Keeping track of when and why your cat is meowing can help you understand what they are trying to communicate, and if the behavior seems out of the ordinary, it's always a good idea to consult your vet for advice. 3. Lethargy or low energy. While cats love their naps, a cat that seems unusually sluggish or uninterested in play could be showing signs that something isn't right. Lethargy can point to various underlying health concerns, such as infections, dehydration, or pain that isn't immediately visible. Cats are good at hiding their discomfort, so if your typically active feline suddenly appears withdrawn or uninterested in their favorite toys, it might be their subtle way of signaling that they're not feeling well. Emotional distress can also play a role in lethargy, especially if there have been changes in their environment, like a new pet or a move to a different home. If your cat continues to show signs of low energy or avoids usual activities for more than a day, it's a good idea to contact your veterinarian. Early detection can make a big difference in treating any potential health issues and getting your cat back to their playful self. 4. Excessive grooming or bald spots. Cats groom themselves to stay clean and maintain their sleek coats, but over-grooming, especially to the point where bald patches appear, could indicate a deeper issue. When your cat starts licking obsessively, it may be their way of trying to self-soothe during times of stress or anxiety. This behavior can be triggered by environmental changes, such as a new pet, a move, or changes in your routine, leaving your cat feeling insecure. Beyond stress, over-grooming might point to underlying health problems like allergies, skin irritations, or even pain in a specific area of their body. It's essential to monitor this behavior closely, as excessive licking can lead to skin infections if left untreated. A vet visit can help identify the cause, whether it's an emotional trigger or a medical issue, and provide the right treatment to help your cat feel more comfortable. 5. Hiding or avoiding interaction. When your cat starts hiding more than usual, it could be a sign that something is troubling them. Cats naturally seek out secluded spots when they're feeling unwell or overwhelmed, as it provides them with a sense of safety. If your normally social cat suddenly retreats to a closet, under the bed, or another hidden place, it's essential to take note. This behavior could indicate stress, anxiety, or a developing health issue. Instead of forcing your cat out, observe their behavior carefully to see if other symptoms accompany their hiding, such as changes in appetite, lethargy, or excessive grooming. Sometimes, environmental changes, like new pets or unfamiliar visitors, can trigger this behavior. However, if the hiding persists or seems unusual for your cat, a trip to the vet is recommended to rule out any underlying medical problems. Identifying the cause early can help your cat feel safe and comfortable again. 6. Frequent vomiting or diarrhea. Occasional hairballs are a normal part of a cat's grooming routine, but frequent vomiting or persistent loose stools are cause for concern. If your cat is throwing up more than usual or experiencing diarrhea for over 24 hours, it may indicate a gastrointestinal issue, infection, or even food allergies. These symptoms shouldn't be ignored, as they can point to underlying health problems that need attention. Dehydration can quickly become a serious issue when vomiting or diarrhea persists. Keep an eye out for signs like lethargy, dry gums, or decreased water intake. 7. Aggression or sudden mood changes. A usually friendly cat that suddenly becomes aggressive, hissing, swatting, or even biting, could be trying to tell you something is wrong. These sudden shifts in behavior are often signs of underlying discomfort, fear, or illness. Cats may lash out when they feel vulnerable, stressed, or in pain, so it's important to take these cues seriously and not dismiss them as mere mood swings. Pay attention to patterns in your cat's behavior. If aggression arises when you touch a specific area, it might point to an injury or an internal health issue, like joint pain or digestive discomfort. In these cases, it's best to schedule a vet visit to rule out any medical problems. Addressing the issue promptly can not only relieve your cat's distress but also prevent the situation from escalating into ongoing behavioral challenges. 8. Changes in litter box habits. If your cat suddenly starts going outside the litter box, it's more than just a frustrating habit, it's often a sign that something is wrong. Cats may avoid the litter box if they're experiencing urinary issues, like infections or blockages, which can make peeing painful. Stress, anxiety, or changes in their environment can also trigger this behavior, especially if the litter box isn't clean or is located in an uncomfortable spot. Ignoring the issue can make things worse, so it's essential to take action quickly. Check if the litter box is clean and easy to access, and consider any recent changes in your home that might be affecting your cat's behavior. If the problem persists, it's time for a vet visit to rule out medical issues like urinary tract infections or kidney problems. Catching these issues early not only saves your carpets, but also ensures your cat stays happy and healthy. 9. Unusual weight loss or gain. Unexpected weight changes in your cat are worth paying close attention to, as they can be a sign that something is amiss. If your cat is losing weight despite eating the same amount, or even more, there may be an underlying health issue at play. On the flip side, unexplained weight gain without any changes to their diet can also indicate a problem. Conditions like hyperthyroidism, diabetes, or gastrointestinal issues could be behind these fluctuations. It's crucial to monitor your cat's weight regularly and act quickly if you notice any significant changes. Even subtle shifts in weight can point to underlying medical conditions that need prompt treatment. A vet visit is the best way to get to the root of the issue and rule out any serious health concerns. In some cases, your vet might recommend blood tests or dietary adjustments to help get your cat back on track, ensuring they stay healthy and happy. 10. Panting or labored breathing. Unlike dogs, cats rarely pant, and when they do, it's usually a sign that something is wrong. Cats may pant if they are extremely stressed, overheated, or have just engaged in intense physical activity, but these scenarios should resolve quickly once they calm down. If your cat continues to pant, appears to breathe heavily, or struggles to catch their breath, it could indicate a deeper health issue. Panting in cats can point to underlying conditions like heart disease, respiratory infections, asthma, or even fluid buildup in the lungs. This type of distress isn't something to ignore, it requires prompt veterinary attention to identify and treat the cause. If you notice these signs, try to keep your cat calm and cool while you prepare to take them to the vet. Timely care is essential to address the issue before it escalates into a more serious health emergency. What you can do to help. If you notice any of these signs, the most important thing is to take them seriously. Cats are known for hiding discomfort, so unusual behavior can be an early clue that something isn't right. Paying close attention and acting promptly when you spot these warning signs can make a significant difference in your cat's health and well-being. Regular vet checkups are essential for catching potential health issues before they become serious. Alongside professional care, creating a safe and loving environment helps reduce stress and supports your cat's overall happiness. Providing affection, mental stimulation, and monitoring their behavior closely will ensure your feline friend stays healthy, comfortable, and content for years to come. Cats might be subtle in their cries for help, but by learning to read their behavior, you'll be able to respond when they need you most. After all, your cat depends on you, and recognizing these signals is part of the special bond you share with them. Whether it's a health issue, stress, or a behavioral change, knowing the signs of distress in your cat can help you act quickly and get them the care they need. Keep an eye on your furry friend. They might not use words, but they're always communicating with you in their own way. Until next time.